Good afternoon. I'm Dr. Angeli Misra and I'm a consultant pathologist in Lifeline Laboratory. What are the tests that you need to do to understand whether you have heart disease or not? So the heart disease, which is the most common heart disease, occurs because of the blockage of the arteries, leading to decrease in the blood flow to the heart and dying of the heart muscles to what is a condition known as heart attack. Now, there are some simple blood tests that you can do starting as early as 20 years to understand whether you have heart disease or you are prone to heart disease. The first amongst these tests is the lipid profile. The lipid profile is the test that tells you about the amount of cholesterol you have, the amount of good cholesterol or the HDL cholesterol you have, the amount of LDL or the bad cholesterol you have, and also the triglycerides that you have. If the cholesterol is high, there are more chances that you will develop heart disease. Second test that is very important is a test known as Hscrp or high sensitive C-reactive protein. This is a test which tells us whether there is subclinical inflammation going on within the body. If this test is positive and these values are high, there is more chance that there will be the formation of atherosclerotic plaques in the blood vessels, and these can then lead to blockage and then they can lead to a heart attack. The third test that is very important to do is something known as NT-proBNP. This is a test that will tell you whether one is suffering from heart failure or not. What is heart failure? Heart failure is when the heart muscles do not have the capacity to pump the blood in a normal, efficient manner. That is, that they are not working normally and therefore the blood gets stagnated and the heart is not able to push out the blood and the blood gets stagnated and there is a backflow into the lung. Now, to detect whether you have heart failure or not, the test that is done is known as NT-proBNP. If the values are high, it indicates that there is a heart failure going on which needs to be treated. The fourth test that is recommended is something known as lipoprotein little a. What is lipoprotein little a? Lipoprotein little a is a type of lipid in the body which is not altered by the lifestyle. It indicates that there is a genetic propensity or a genetic cause in the heart disease. So, if the values of lipoprotein A are high, there are more chances of having genetic predisposition to heart disease. The fifth test that is very important are the troponins, that is troponin I, troponin T. These will indicate if the heart muscle is damaged because of whatever reason. It can be an inflammation of the heart or it can be lack of oxygen. So these are the 5 tests that are very important to detect and to prevent your heart attack or heart disease. In addition to that, there are certain other tests that can be done to know about heart disease. One simple test is the ECG. If there are any symptoms, an ECG should be done. The second test that needs to be done is a treadmill test. And the third test that needs to be done is an echo test. If there are any abnormalities in any of these tests, then what you need to do is you can first do what is known as a CT angio of the heart. Thank you very much. Stay safe, stay healthy, and prevent yourself from heart disease.